Hi there, this is your CT Style Express, and I'm Teresa Dufour. As the pandemic continues on, how are you and your loved ones holding up? In between homeschooling, working from home, job loss, fear of catching the virus, and of course, social isolation, it can be challenging to say the least. A new study examines the state of America's resilience, and here are the details and advice for these trying times is board-certified child psychiatrist Dr. Stuart Lustig, also the National Senior Medical Director for Behavioral Health over at Cigna. Doctor, thank you so much for making time for us today.
Thank you. Good to be with you, Teresa.
Right. So let's talk a little bit about resilience. Explain to our viewers exactly what you mean by that.
Well, as you said, we are really living through unprecedented times at this point between a COVID pandemic and concerns about homeschooling our kids, racial injustice. A lot is going on in 2020. And resilience, which is that ability to bounce back from these kinds of difficult circumstances, resilience is at risk in 60% of Americans that we surveyed using the Cigna Resilience Index. So 60% is a big number that we are concerned about.
Yeah, and let's talk about the survey and some of the findings. What else was notable?
Well, one of the things we noted, and here's the good news if there is some, is that children inherently start off with a certain amount of resilience. We're born with that, but then there's a resilience curve, a U-shaped curve that we noticed in the findings. So kids start off as resilient, and then between the ages of 11 to 17 or so, that resilience starts to drop off, bottoms out at 18 to 23 before climbing back up on the other side as children become parents themselves. And then for workers, we also found that working is a good thing. Resilience is associated with working. The less you're working, the less resilient you seem to be. And that's true from full-time to part-time down to furloughed workers. And then the least resilient workers were those who were not working at all, which unfortunately is the state for many folks these days.
Yeah, so let's talk a little bit about low resilience. What does that do to you as a human being?
Well, there are a lot of correlates of low resilience that we found in the study that we did. In kids in particular, we see that they are more likely to be struggling emotionally. They also have physical ailments as well. And importantly, their self-esteem is lower. They don't feel good about themselves. They don't feel like they fit in. They don't feel like other kids want to play with them or be with them. So that's really significant for kids. And then for adults, what we find in the workforce is that many of them feel unsatisfied with the work environment that they're in. They don't engage as much. Their performance is lower. And they also tell us, and this is particularly important for employers, the workers tell us that they're more likely to quit. So some real impacts for worker retention.
Sure. So, Doctor, give us some ways to cope with these issues and then build up our resilience.
Sure. Well, here's some good news in all of this is that there are ways to build up resilience at any point, wherever you are in the life cycle. And we have, for example, on our website, cignaresilience.com, a grow forth approach to building resilience, where the letters of the word grow, G-R-O-W, remind us what we should be doing to build resilience. So G, for example, is ground yourself in the situation. Really focus in on what you'd like that ideal outcome to be. R is recognizing what you can control, as opposed to focusing on all the other stuff that's going on out there. O is organizing the resources that you need to navigate to build your resilience. And W, finally, is working with your community, reaching out to people for support, and recognizing, importantly, that it is a sign of strength.
And Dr. Leslie, I want to ask you, is there a connection between loneliness and resilience?
Well, there is. Cigna is a global health services company. Is interested in anything that impacts body and mind and the integration of the two. And before we studied resilience, we've been very interested in loneliness. And one interesting finding that connects both resilience and loneliness is that Gen Z, the folks who are 18 to 22, 18 to 23, that is really a risky time. You're most likely to be lonely at that time, and that's also when your resilience is lower as well. So there is a connection between the work we did with loneliness and that of resilience.
Sure. All right. We can learn more over at cignaresilience.com. Dr. Lustig, thank you so much for all of the information and the advice, and we'll keep a positive outlook here as best we can.
Thanks so much, Teresa.